4, 3, 2, 1. We are live.
Good evening, faculty and dear friends. Today we will be having a great debate, never held before like it. We have great speakers with us. Today we will be having Dr. Mukul Tiwari, the President of IMLEA,
Namaskar.
and Dr. Anurag Verma, the Secretary of IMLEA. The topic of the debate is, are ethics still relevant in today's medical practice? And they will be speaking for the topic. The team against the topic is Dr. A S Jaggi and Dr. Neeraj Nagpal. So Dr. Jaggi and Dr. Nagpal will be speaking against it. And we are having a very special guest, the founder president of IMLEA, Dr. Satish, with us.
Good afternoon, everyone.
Good afternoon, sir.
Professor. Good afternoon. And shortly, the Secretary of IMLEA Uttarakhand will also be joining us. Dr. Vijay Tyagi will be joining us. So it's my proud privilege to introduce our speakers of the day. So our first speaker is Dr. Mukul Tiwari. He is a pediatrician and a medical legal expert. He belongs to Gwalior. He is past president of MP chapter of IMA. He has been member of Central Working Committee of IMA, and he is a very active in medical legal field as well as pediatrics, both the things. So he will be speaking for. I would request Dr. Mukul Tiwari, please start your debate.
Thank you very much, Sirohi, sir. And I welcome all the esteemed panelists and participants in today's great debate. And I hope this is going to be a very interesting session for all of us to hear. Now, medical ethics, are they relevant in today's medical practice? Well, I don't know why this question should be asked. Probably it has been asked in the view of the changing medical scenario and the changing medical doctor-patient equation. But it is definitely a very questionable topic. Now, whether ethics are required in medical practice, it is same as, or rather, in other words, whether a doctor should maintain ethics in practice. It is just like asking father of a church or priest of a temple whether they should behave in a graceful manner, in a holy manner, expected of them in a church or a temple. Do you expect them to get rid of their graceful behavior, their holy behavior, calming behavior, and start behaving like a common person? The same stands for doctors. How can we ask doctors to get rid of their ethics? Then what will they become? They will become just like a common person, a common businessman who does business and haggles with the customers. All our status of respect will be gone away if we keep the ethics away. Father of a church deserves and demands so much respect. Priest of a temple demands so much respect. So in the same way, we doctors also demand respect, command respect. Sorry, I've been using one demand, not demand. Father of a church commands respect, and a priest also commands respect. In the same way, a doctor also commands respect given automatically by the patients. Whatever may happen in the medical practice and in whichever way the society change, but doctors still maintain a lot of respect from the patients, which is not, this kind of respect is not given to other sections of society, to maybe to engineers, to politicians and other things. The kind of respect doctors get. Then ethics is the first requirement of medical practice. Whether it is a single practice, a group practice, or a corporate hospital. Whichever kind of practice is there, ethics is the first requirement. In patient's eyes, your respect is only as long as you maintain ethics. The day you shed ethics, the respect will be gone, as I said earlier. Ethics were relevant even 1,000 years back. They are relevant today, and they'll be relevant 500 years from now. Nobody can take out ethics. Now, what is fiduciary relationship? Fiduciary word is a Latin word for confidence or trust. The bond of trust between the patient and the physician is vital to the diagnostic and therapeutic process. It is necessary for the healing. It is necessary for the patient to take the full treatment. It forms the basis for doctor-patient relationship. In order for the physician to make accurate diagnosis and provide optimal treatment, this relationship is a must. So fiduciary or trust or confidence. So this is all part of ethics. When confidence or trust is gone, there is no meaning of medical treatment. Now we talk about the principles of ethics. We know the 4 pillars of ethics: autonomy, beneficence, non-maleficence, and justice. All these 4 are a must for the healing process in the medical practice. For the healing process and also for the medical practice. You can't work, you can't practice without these, without maintaining these ethics. Now look at the autonomy. Autonomy is the patient's right to refuse or choose the treatment offered by the doctor. It is our arrogance, doctor's arrogance, if we think that the patient should always agree to everything we say. So, patient's autonomy has to be respected. Second pillar of ethics is beneficence. A practitioner should act in the best interest of the patient, not in his own interest. Whatever action the doctor takes, he should always remember that patient should not be harmed by those actions, and he should not take extra money. He should not order anything which is not in the best interest of the patient. Suppose the best interest of the patient is by stopping the treatment, by discharging the patient, even if it hurts our financial interest. Doctor should do that. Third is non-maleficence. That is, first to do no harm. We sometimes hear of the cases that patient has gone for one complaint to the hospital and they do some tests. It is more common with the corporate hospitals. They do some tests and come up with something in the diagnosis which is not related to the original complaint. Then they start treating that a clear violation. Did I miss some points in between?
We got you off air for some time.
So
Few
I
seconds.
will repeat the last. I was talking about non-maleficence.
Yes.
That is, first to do no harm. Patient goes to a hospital for a complaint. They do some tests and come up with something which is not related to the original complaint. And they start treating what they have come up with. The patient went there for pain abdomen, left lower half, and they have diagnosed stones in the gallbladder, cholelithiasis. And they start treating cholelithiasis, the operative surgery, this and that, and eventually the patient dies. Now, this is a clear case of breach of first to do no harm, violation of this principle, this medical ethic. Now, next is justice. Patient should get justice irrespective of caste, color, creed, region, and prejudices. And justice is related to who deserves the treatment on first priority, the more sick patient or the less sick patient. A patient who has come after a severe accident needs immediate treatment, blood transfusion, etc. And a minister's car also comes, his son comes down from the car, he's got a minor fracture. So who should get the first treatment? The more severely hurt patient, and not the minister's son. So these are the principles of the tenets of the pillars of medical ethics. Now, those who question the ethics that we cannot be a noble person anymore, to them, I want to say that you have chosen this noble profession out of your own free will. Nobody was forcing you to come to medical profession. But I am sorry to tell you that this profession is definitely related to noble professions. It is one of the noble professions, like church, like temple. And if you have come only for the glamour of money or glitter, then I'm sorry. You may leave this profession. And then I'm saying that why you worry so much? You may still earn money while maintaining ethics. That is also possible. If you leave, if you maintain ethics, it doesn't mean that you will not earn money. Many doctors are doing totally ethical work and earning full money, rather more money, because their patients become their fans. So there's no need to think that if you put aside ethics, you will make more money. If you do unethical practice, you will yourself feel uncomfortable in the core of your heart. So why not earn with clear conscience? And not only medical profession. Am I audible?
Yes, yes.
Okay. Not only medical profession. In fact, every profession needs needs their ethics. An advocate has to maintain his own legal ethics. A chartered accountant has to maintain his own ethics. So ethics is very important. I cannot simply understand why we are talking that can we do without ethics, or whether the ethics are still relevant. Of course, we have to avoid unnecessary admissions, unnecessary investigations, make more use of clinical sense. Whenever some tests, admissions are necessary, reason of their necessity should be explained to the patients. Then we are all aware of cut practices, so we should avoid that also. And then in our own nursing homes and hospitals, their disparity in the actual cost of surgicals and IV fluids. Whether the print is something and actual cost is something. So we should avoid that also. So I hope I have made my points clear. And thank you very much for patient listening. Am I audible?
Thank you, sir.
I have finished.
Yes, you have finished. Thanks for lightening about your points. And today we also have Dr. Anurag Verma with us. He is the Secretary of IMLEA. He is a physician and a medical legal expert. He is also a lawyer. He has done his LLB, LLM, and he is also professor of law. So I would request Dr. Anurag to finish to start his talk. Dr. Anurag, unmute yourself. Dr. Anurag, unmute.
Thank you very much, sir, for inviting me. Am I audible?
Yes.
Sir, I have unmuted, sir. Am I audible? Or
Yes,
Yes.
yes.
am I audible properly?
Properly.
Okay. I welcome you all to this debate session, especially Dr. Mukul Tiwari, sir, Dr.Neeraj Nagpal, sir, Dr.Satish Tiwari, sir, and Dr.A S Jaggi, sir. I am taking side of the ethics, and these are really very relevant as far as medical practice is concerned, especially after imposition of CPA. These have become rather more important. How? I will tell you. As far as law is concerned, there is nothing like medical law as a separate entity in the domain of law. There are no legal provisions specifically for medical negligence or medical treatment and for other intricacies of the profession. There are provisions of law which are applicable to medical profession. That is one thing. There is no formal education regarding ethics in medical colleges. So doctors are unaware of various ethical norms and are not able to solve ethical dilemmas many times, especially when they come into practice. While they are in medical colleges, they learn about these things from their professors and all other seniors. But now these things have also changed. The ethics are getting changed over there also. So you know it better. So there are many ethical dilemmas in practice which they have to solve. There has to be there is no clear-cut law as far as medicine is concerned as medical law. So there has to be a clear-cut methodology which is defined very specifically for the practice of medical profession, which is conversant with the provisions of law which are applicable to the medical profession and to meet ethical standards in practice. Reason being, every medical professional cannot be expected to be aware of different provisions of law applicable to medical profession, as law being a separate domain in itself. So this code of ethics was promulgated to provide doctors proper ethical and professional standards in practice to ensure safety and well-being of patients, as well as safety and well-being of the doctors themselves from the clutches of law. Ethics which are expected from doctors are very essential for a safe and secure medical practice, as well as for the best possible treatment of the patient. So ethics are very vital and relevant for medical practice, more so in the present scenario of commercialization, advancements in technology, and imposition of CPA on medical profession. Medical ethics are a set of moral principles, beliefs, and values which guide in making right choices for medical care. After promulgation of Code of Ethics, these principles have been imposed on medical professionals to follow in practice, and this is very essential. This was done because of these being vital to the fact that medical profession is a service to mankind. Here the intent of service is more important rather than profiteering. There are businesses where this component of service is relegated to background and profiteering comes on the forefront. But even in those businesses, which are businesses in true sense, undue profiteering is not allowed there also. There is also a component of service. And the medical profession being a service primarily, so it is for the people who come here to survive, not to earn extra money, but who come here with the intention to serve the mankind. And this is the truth which will remain. And now when the times are such, these commercial considerations are more important. Even then, if the doctors, they also want to earn money like other businessmen. So it is also my opinion, along with our respected Dr. Tiwari sir, that these people should not join this profession. This profession is not for them. They should go to some other profession, because here they have to follow the ideals of the profession. And by following the ideals, they can survive. And they can survive in a very good manner and with respect. With many multi-millionaire businessmen, they cannot have. So now coming to this was done because of this being vital to the fact that medical profession was a service to mankind, and to ensure the medical profession being within the parameters established by law. So by following ethics, as well as the doctor should practice as per law. Now I come to the relevance of these ethical principles for patients. I will not go clause by clause because time is very limited. So whatever is written in the code of ethics, which the medical practitioners they have to follow. So this is in interest of the patients, in interest of the doctors, and in interest of the society as a whole. Because if we follow the ethical principles, the doctors follow the ethical principles, what have been said in these code of ethics. So the patients will will get a just and better treatment. They will have a knowledge about the disease they are suffering from. They will have a knowledge of treatment options which are available to them, and details about the treatment which they are being given. So they will be in touch with the whatever approach doctor is adopting, and this will be a kind of share treatment, and the doctor will also be benefited, because in case of any untoward outcome, the patient will not be in a position to blame the doctor. So in this era of commercialization, and when the CPA is there, doctor will be saved on this aspect also. And when the doctor details everything about the treatment of the patient and to the attendants, then at proper time, it will be a duty of the doctor, and he will realize it himself or herself, that he should give a proper advice at the proper time for referral of the patients to health. This will also be in the interest of the patient. As far as society is concerned, if these ethical principles are followed, no malpractices are there, so there will be no chaos in society, no unrest, no malpractices will be there. For example, false advertisements, qualifications are not there with the doctors and they are treating the patients. This will not be there. There will not be touts, commissions, and cross-pathy, etc. So society will also get a very good treatment, medical treatment, which is congenial to healthy growth of the individuals in society. And without these guidelines, medical malpractices would go unpunished, and more importantly, lives would be lost. So it is very important for society itself. Now coming to the doctors. After CPA was imposed on medical profession, and the doctors, by reading these ethical guidelines, and many of them, they have an idea about the CPA, they will know that because it is written in ethical code itself, that a doctor should take legal steps like consent taking and detailing treatment to the patient. So every doctor will come to realize that every patient is a potential litigant. After inclusion of medical profession within the CPA, so he should treat the patients as per regulations himself. So he will not be, caught into the clutches of these legal provisions of CPA. Doctor should be careful about communication with the patient. Dr. Tiwari has said just now. Doctor-patient relationship is fiduciary, and that is based on trust. It's a disease for doctor, and they are treating a diseased body, but it is a disrupted life for the patient. Patient life is disrupted when he or she gets any disease. He doesn't understand in the terms of medical knowledge as such, but his life is disrupted. He wants to get cured. He wants empathy at that point of time. So the doctor should be empathetic rather than mechanical. Mechanically, doctor should not treat. He should empathize with the patient. Good patient relationship, doctor-patient relationship works as a buffer against the litigation and violence. This we all appreciate. So by following these ethical principles, this is written in Code of Ethics that the doctor should maintain the dignity of the profession.
And it is written in Code of Ethics.
That am I audible, sir?
Yes.
Doctor should adopt a human approach while treating the doctor. So a good patient-doctor relationship works as a buffer against the litigation and violence. Patient should be given proper time. He should be heard and should be understood. Patient always appreciates these qualities of a doctor. And after that, if even inadvertently something goes wrong on part of the doctor, even then the patient forgets it, and he will not approach to the courts against the doctor. So this is the importance of doctor and patient relationship, and that is to be followed after following these code of ethics. So these are very relevant. I would say rather more relevant during the present times than ever before. As far as medical records are concerned, in Code of Ethics, it is clearly mentioned that the records in indoor patients are to be maintained by the doctor, and in upcoming NMC regulations, it is extended to OPD records also. So while we are saying that the OPD records should be with the patient, but they are saying that the OPD records should also be maintained by the doctors. So proper documentation is very important as far as treatment part, as far as the treatment on part of the doctor is concerned. Then if in case of prescription, in medical certificates, there is a in medical certificate, in case of other certificates, it is defined in Code of Ethics that how these can be given, because there is a defined punishment for false certificates as such, as per section 199, 463 and 464 of IPC, and there is provision of imprisonment also. So the doctor, after learning all these qualities, how to write these prescriptions, they will be not coming under law for these prescriptions and medical certificates. So ethical principles, if they are followed in practice, doctors will be saved from this false certificate aspect also. Now, if we come to consent, then consent is must legally, but it acts as an insurance against a medico-legal. It is a shared treatment, so patient is also satisfied, as I already said, and in case of any unwanted outcome, shall not blame the doctor. As far as treatment is concerned, I am talking only as per ethical guidelines. Whatever I am talking here is very well documented in ethical guidelines. In not saying again and again that I have taken this from ethical guidelines. Very important. Yes, sir. So as far as treatment is concerned, doctor is not to treat the patient beyond expertise. He is not able to treat the patient. It is beyond his capacity or specialty. The doctor should refer a case to another competent doctor. It is also mentioned in Code of Ethics, and it is very important. The doctor has to follow an accepted line of treatment. So if the doctors, they follow these ethical guidelines, the patients are very well in confidence of the doctor, and they know that whatever doctor is doing, doctor is doing for their benefit. Here comes the importance of beneficence. And the patient will understand the doctor, and the doctor will be protected from any kind of violence, lawsuits, and also very important, from the disciplinary action by the regulator itself who has founded these codes of ethics. And it is very important for us. Now, doctors must be able to solve the ethical dilemmas, take right decisions based on their views, while treating within the laws that they are governed by. Difficulties in practice of medical profession, which are mentioned very loudly by people nowadays, like taking so many licenses, they are covered by so many laws and all other pollutions, etc. Difficulties in practice of medical profession does not mean that the ethics have lost their relevance. There are difficulties in medical profession. So here also, if the profession has to be regulated in the interest of society, the pollution is being created, so it has to be regulated. There is no doubt about it. So many licenses, if they are required by the government, these are to be procured by the doctors. But it doesn't mean that practice has become difficult. I agree. But this doesn't mean that the ethics as such have lost their relevance. Ethics are very relevant for doctors to do a hassle for government. If we see from a different perspective, to fulfill its obligation, which is entrusted upon it by the Constitution as per Article 21, to preserve life, which is possible only when the doctors follow ethics in medical practice. So it is very necessary for the government also that they see that the doctors are following the law of the land and the code of ethics which has been entrusted upon them. So by evaluating from all these aspects, it's my very considerate view that the ethics are very relevant to medical practice and shall always remain so. Thank you very much.
Thank you, Dr. Anurag.
Thank you, sir. I have completed.
Very vocal advocacy of the ethics in medical practice, and I'm sure that your opponents have some points in their armor to show that what should be done. So I would invite Dr. A S Jaggi. He is a general and laparoscopic surgeon at Meerut, and he has done his diploma in medical legal studies, and he is a medical legal expert also. He is executive body member of IMLEA and very active in medical legal field. So over to you, Dr. Jaggi.
Thank you, Dr. Sirohi. I am grateful to the organizers of this debate, the Uttarakhand IMLEA division, under the auspices of the Indian Medical Legal and Ethics Association. I feel really honored to be amidst such knowledgeable dignitaries in the field of medical law. I have been asked to speak against the contention for the topic of the today, which is, are ethics still relevant in today's medical practice? My learned, very dear friends, Dr. Mukul Tiwari and Dr. Anurag Verma have highlighted very, very nice, valid points in favor of the topic. I beg to differ to some extent, as I find many more factors where medical ethics seem to be unnecessary or irrelevant. Medical ethics have a long history of being debated from days of Hippocrates till now at present. We all know that the concept of ethics is very dynamic and same principles may not be followed everywhere. Medical practice is governed by ethics, acts and guidelines. In India, it is the National Medical Commission and Ministry of Health and Family Welfare which are the main governing bodies. But because there is a very narrow and thin line between being ethical or unethical, the ethics are flouted knowingly or unknowingly. Though medical ethics is a system of moral principles that apply values and judgments to the practice of medicines, but we are deviating from the norms on many grounds. Let me put forward a few examples. I draw your attention to the vaccination drive for COVID disease. This has not been a complete long-term trial for these vaccines available. Their long-term benefits and side effects are still unknown, but they are being used worldwide in good intention to save the lives, but it is unethical to do so. Risk of stroke and coronary episodes are still being debated. Even distribution of the vaccine strategies were unethical. More so, tell me how many doctors and nurses were treating the COVID patients in ICUs and the wards. Was this according to ethical norms? I still cannot forget the scenes where patients' relatives were asked to bring their own oxygen cylinders to get admission into COVID hospitals. Many drugs were used to treat COVID without evidence of them being effective in COVID. Remdesivir is one of them. Even the dose of remdesivir used for treating COVID was with hit and trial. Therefore, I ask again, was this not deviating from the ethics? COVID vaccine has been linked to infertility. Those young girls who have received this vaccine do not know what is in store for them in the future. Many pharmaceutical companies have used unfair means to get their drugs approved for use in COVID disease. There are court cases where employees have challenged the employers for forcing them to take vaccinations or lose their jobs. Even hospitals refused admissions to non-vaccinated patients. In day-to-day practice, many of the drugs are prescribed that are harmful to the patient, as every patient is not investigated to be having any underlying disease, so as to say liver or kidney disease. A lady in very early stage of pregnancy does not even know that she is pregnant and may seek medical advice for any ailment which may be harmful to her or the fetus. This is how medical ethics are ignored from time to time at the convenience of government and medical commission, and making doctors scapegoats when judiciary steps in. I know that it is very uncomfortable feeling to go against the medical ethics. Sometimes we are fooled or swamped by wishful thinking. Physicians should be honest to their patients, even if they are unethical, but they should be able to defend why they deviated from the ethics. Let me give another example. A patient visits the emergency department with acute excruciating pain in the abdomen with low blood pressure. His CT scan indicates that he has dissection of the aorta. The clinician explains and advises immediate and urgent surgery. The patient refuses to give the consent for immediate surgery as his near and dear ones are not present. The doctor, knowing that the patient may die if time is wasted, he sedates him and takes him immediately for an emergency surgery, and ultimately the patient survives, but with a large midline xiphopubic scar. Here the doctor deviated from the ethics and operated without consent and without even knowing the outcome of the surgery. Now I leave it to your imagination that the poor doctor could be sued for operating without taking an informed consent. And if the patient died, the things could have been worse. We have then left to the mercy of the judiciary and the me lord, who we don't know what he'll pronounce to you. The patient may also sue the doctor for an unwanted scar on the abdomen. Other examples are euthanasia, surrogacy, especially gestational surrogacy, where ovum belongs to the surrogate mother and leads to many legal battles. Let us talk about some religious grounds of being unethical. Male circumcision is the surgical removal of the foreskin that is the prepuce from the human penis. In an infant or a child, the ethics of circumcision in neonates and children is source of much controversy. There is substantial disagreement amongst doctors and political scientists over this practice and is definitely a deviation from ethics. The poor infant does not even know what is happening to him and is subjected to such torturous trauma. The pharmaceutical industry too does not lag behind. Many products are being sold totally on advertisement stunts, cheating the common man for lack of his knowledge about side effects and toxicity. I have seen these drugs being used and sold in grocery stores also. The MRP on various drugs and surgical items is more than even 200% or even 500% from the actual cost. Say injection of meropenem, which is being sold for rupees 4,000 in a corporate and other big hospitals, while it is available with an MRP of rupees 500 or even less by other standard companies. This is true for many other drugs also. All this is happening under the nose of the health department. I therefore again ask you, is all this is allowed by the drug controllers and health supervisors? What is the relevance of ethics in today's scenario? Even we doctors, who are very much aware about not advertising large claims about specific treatments, but everyday newspapers are full of such advertisements. Nowadays, advertisements on FM radio are heard every few minutes and repeat umpteen number of times 24/7. The corporate hospitals advertise on social media and with big hoardings about their team of doctors and offering latest gadgets like radiotherapy, robotic surgeries, etc., etc. Their take is, will people come? How will people come to know about newer and latest mode of treatment? And I agree, rightly so. In today's scenario of advancement in medical science and technology, the advertisement is quite justified if done with the right intention. It is very much justified to advertise about your special skills, honors, and achievements. Of course, not like Baba Ramdev, who offers treatment and cures for all diseases in this universe. May I also draw your attention to the so-called cut practice in our profession. In other trades, it is justified to give commission. Example, the LIC of India, a giant government enterprise, works totally on commission to its agents. Marketing executives and retailers are given a handsome monetary rewards and foreign trips if they fulfill the company's targets. The customs department also rewards its team with a percentage of seized contraband. But if a doctor shares his profit with a fellow colleague, it becomes unethical and punishable. To conclude my debate, I very humbly state that the dominant conception of medical ethics being rather imposed and taught continuously, in my opinion, is pointless. Even so, that its introduction into the medical curriculum is what I can call a futile search for intellectual responsibility. I repeat, a futile search for intellectual responsibility. These ethics are cumbersome machinery of theories and principles given on a platter to a practicing physician. It is like whether to keep or return a wallet which you find on the pavement. Improvisation, adaptation, modification, and fine needful adjustments are mandatory in day-to-day practice. Shift in our approach, action, and behavior is of profound and paramount importance and is the need of the today than even before. In my opinion, I say again that ethics alone will not improve medical care. There are many more factors that need to be considered, like social framework in our country, corporates taking over the healthcare. You know, the corporates question the doctors working with them that we pay you 40 lakhs per year. What have you given us in return? So they are always profit conscious. The Consumer Protection Act, the pharma industry, the media and the press the insurance and mediclaims, local small goons, chutbhaiya netas, make you feel timid in the Indian scenario. All these need to be scrutinized. In the end, I ask again, are the ethics relevant in today's medical practice? I feel doctors should have the right to clinical independence, freedom and expression and freedom of opinion without any victimization. As has been rightly said, that, and I quote, National Medical Commission is a slippery slope where things keep on changing without any clarity. Thank you for your patience in hearing me out. Thank you very much. Dr. Sirohi.
Thank you, Dr. Jaggi. It was so convincing, your tone and your arguments, that we have to rethink about the ethics and are ethics only for doctors, not for others. But then now it is time to hear our Dr. Neeraj Nagpal, the director of MLAG and voice in the country, and what not to say about him. He is we look after his advice for everything, and he so aptly does the things and thinks what others don't think. I'm not able to express myself about Dr. Nagpal, but the audience and viewers will be convinced when he will speak. Dr. Nagpal, he will be speaking against. Over to you,
Dr.
Dr.
Sirohi,
Nagpal.
the topic given to me today is, are ethics still relevant in today's medical practice? And I have been given the ethical responsibility of speaking against the motion. It's a difficult job because what is universally accepted, I have to be speaking against. I will take up certain points which I have seen raised. Dr. Tiwari has compared doctors to fathers of churches, but sir, fathers of churches do not get beaten up routinely as doctors do. Your other issue was, if doctors are not ethical, they will not be respected in society. Well, sir, doctors are no longer respected in society today. So is there any point in remaining fixed to our ethics? And number 3 is something which I feel the previous speakers are a bit confused on. That is, there is a difference between being ethical and being greedy or trying to earn too much, because ethics is something which is universally applicable. It is applicable to a resident doctor working in a government medical institution. It is also applicable to a corporate hospital. And the resident who's working in a medical college emergency has no financial reasons to be unethical. So the point is, they are the issues of who should be attended first. These are the issues which relate to professional ethics, and the earning part and the ethical part need to be separated. Then I am not so sure this is a correct message to give, that doctors who do not wish to toe the line which is given by the government in the ethical regulations either of 2002 or of the NMC RMP regulations bill of 2022, they should be leaving the profession. I'm sorry to say, we need change. We need change in the guidelines. We need change in the scenario. Doctors have been ethical, are ethical, will remain ethical, but the difference in what is actually ethics has to be understood very, very clearly. And if I can be assured, Dr. Verma, that I will not be sued, I will not be beaten up, If only I remain within my ethics, I mean, this would be heaven. This is a fairy tale, because under Consumer Protection Act, the judgments which have been given, 99.9% have nothing to do with the ethics of the doctors. They are based on things which are totally against. In fact, the whole point I'm going to raise in my talk or my arguments is this. So the first question is, we are talking of professional ethics. What ultimately are professional ethics? They are standards which are set by professional organizations. Please understand the word professional organizations, for behavior and values of people working within a specific field. So they have to be made by professional organizations in medical sense of doctors. Number two, I would say my definition of ethics is that it is a way of life and the way we conduct ourselves, which we imbibe during our professional training by observing and working with our teachers. Ethics is always self-imposed and related more to morality than law, which is imposed by outside forces. What the previous speakers are confusing is law, which is imposed through regulations passed by NMC or by the Ministry of Health and Family Welfare by way of notifications or as a law by the Parliament. What ethics is, it is self-regulation. By definition, it is self-regulation and not something which is imposed by way of law. The Hippocratic Oath, yes, this was the first document on ethics, but is Hippocratic Oath the only document on ethics? We have Manusmriti, Kautilya's Arthashastra, so many documents on ethics in politics. Does that create any negative impact on the ethics of, on the image, the ethical image of politicians? Then medical ethics, as has been mentioned by a previous speaker, are constantly changing. It is fluid. If you go through the history, from Hippocratic Oath in 5th century BC, there was Nuremberg Code in 1948, Declaration of Geneva in 1948, Universal Declaration of Human Rights 1948, Helsinki Declaration 1964, and now the NMC draft, NMC Registered Medical Professional Conduct Regulations 2002, which recently came into public domain. Believe it, it is 104 pages. Where did it start from? It started from Hippocratic Oath, which contained basically 5 things. Already Dr. Tiwari has elucidated to those. You have to do good. You should not do any harm. You should respect your teachers. Do not discriminate among patients, and prohibition against abortion, euthanasia, and sex with patients. These were the principles which were to be adhered to as part of medical ethics. The principle of patient autonomy and social justice, these were not part of medical ethics earlier. These are things which have been introduced by law now. And these are things which are causing the maximum heartburn. What is it that makes society consider doctors unethical in India? Is it that they do not try to benefit their patients? We always try to benefit our patients. Is it because they do harm to their patients? No, we never try to do any harm to the patient. Is it because they do not respect their teachers? Is it because they have sex with their patients? Is it because they conduct abortions? It is already legal in India. Is it because they conduct euthanasia? Law is confused on this issue. The reason why doctors are considered unethical in India is one and only one, that doctors have been victims of propaganda that they care only for money and fleece their patients. Unfortunately, among us, we have not been able to wipe our minds clear of this propaganda. If all doctors were so greedy and so much in search of money, I fail to understand why no doctor reaches the higher echelons of the people who pay the maximum income tax. I mean, they are okay in the upper middle income group. But are they the high earners of society? They are not. Then my second question is, you talk of professional ethics, but please define what is profession. The fundamental characteristics of a profession are: one, it has to have great responsibility. Number two, it should have accountability, and accountability means self-regulation. I'm again repeating the word self-regulation. Based on specialized theoretical knowledge, institutional preparation, autonomy. By autonomy, here under National Medical Commission Act, it is going to be rebutted that National Medical Commission represents doctors. But I'm going to show why it does not represent doctors. Because one, under an NMC Act, the central government is the supreme authority for all matters. We are supposed to have clients rather than customers. We cannot, as doctors, we cannot choose our clients. We cannot choose our clients. So this creates a problem. There is a direct working relationship with the patients. Ethical constraints are there in a profession. Merit-based and morality is part of the profession. These are the characteristic things which define a profession. Now, Consumer Protection Act defined us, the healthcare, as trade. Patients are now consumers, they are no longer clients. National Medical Commission Act, there is no self-regulation, hence it is not a profession. I will prove why there is no self-regulation under National Medical Commission Act. Multiple judicial, quasi-judicial fora, no doctor to hold doctors accountable. Again, self-regulation means it has to be regulated by the regulatory body elected by the professionals themselves. Now, supposing in 1947, the Britishers had said, fine, we are going to leave India. You want Swaraj. I am going to nominate 500 Indians to rule this country. Would it still have been accepted as Swaraj? National Medical Commission, you have nominations. There is no election from the representative body into the regulatory body. The regulatory body should have been representative and elected by professionals. When you go to the preamble of the National Medical Commission Bill, it states very clearly that principle of the regulated, electing the regulator is flawed and creates a conflict of interest. Therefore, NCI should be discarded. It is a very bold, very provocative statement, which unfortunately, as doctors, as a group, we did not object to. We are in a democracy. And the people who are governed are the ones who elect those who are going to govern them. This is the principle of democracy. And here you are saying educated professionals cannot be depended on to elect regulators from within themselves, as there will be a conflict of interest. As if alcohol bottles and cash is going to flow in the elections and this is what is going to happen. No, the control of the regulatory body was needed by the central government, and this was done through the National Medical Commission Act. In India, look at the following institutions which were set up under law for self-regulation of professionals with elected members. Bar Council of India, Institute of Chartered Accountants, Institute of Cost and Works Accountants, Institute of Company Secretaries, Council of Architecture, Press Council of India. Try and get this to be a nominated body. If we wanted a nominated body, what was the harm in National Medical Commission not being there and doctors being regulated by Ministry of Health and Family Welfare by creating a separate department? This is not self-regulation. And if this is not self-regulation, we are not professionals. If we are not professionals, what are we talking about professional ethics? Today's Indian doctor has to deal with increased government regulation, increasing cost of medical term technology, third-party payment system, aggression and violence, unsympathetic law and order machinery, half-baked medical knowledge, myths and misconceptions, and a demand from patient autonomy and documentation, but in a population which is largely illiterate. You can tell the patient all the 100 complications of doing an ERCP. But if there is a pancreatitis after ERCP, the only thing which the patient is going to tell is, we did not understand what you said. We gave you total power to do whatever you want, and now our patient is dead. So our violence and our filing cases against you in 8 or 9 different fora is justified. Today's Indian doctor, he's a businessman, he's an entrepreneur, he's an employer, he's a counselor, he's a manager, he's a taxpayer, and he has to deal with his responsibilities towards his patients, family members, employees, bankers, nation, society. Why professional ethics today is a book of 104 pages rather than the 5 principles it started from? You have changed the character of professional ethics and made it into a law. And that law is interfering with my actual ethics, which were taught to me by my professors when I observed and when I took my training. What is the basic reason? The basic reason is government, Supreme Court have decided that health is now a fundamental right. This is what the Supreme Court has said. Multiple judgments. I can quote at least 7 or 8 judgments where this has been decided that under Article 21 of Indian Constitution, the right to health is now a fundamental right. But if you go to the Paschim Bengal Khet Mazdoor Samiti versus State of Bengal judgment, it said very clearly, it cannot be ignored that the constitutional obligation of the state to provide adequate medical services to the people. Indian state has, however, pushed this fundamental duty onto private doctors under the garb of ethics. Please understand each word of what I am saying very, very clearly. Under the garb of ethics, the fundamental duty which was to be performed by the government has been passed on to the profession as a whole. And it affects the private sector much more than the government sector, which is anyway performing the function for the government. And also, I have to act as per law, not as dictated by my own ethics in India. If I give you examples, if I don't follow my ethics, it is like I'm not following my mother's advice. But if I'm not following law, it is as if I'm not following what my wife has told me to do. There is a difference between the two. When there is conflict of medical ethics and law, it is law which always wins. I will give you an example. In an emergency department in PGI, there are more than 50 patients at one time who are being bagged by through endotracheal tube by relatives because there is no ventilator available. Now the senior resident gets one ventilator from the ICU, which becomes available. And it is his decision out of these 50 which patient he is to give this ventilator to. Law, according to law, a person who's having a high income, the doctor, if he is sued, the person who has high income to start with will be awarded much higher compensation than a poor patient. I am told not to discriminate on the basis of social standing. Simultaneously, I am told if I do not provide a ventilator to the mother of the judge from High Court, one, I will have a CBI inquiry against me. Totally acceptable. This has happened in PGI. If there is a Supreme Court judge who's being treated and there is some allegation of negligence, the complaint will go to the Prime Minister and the Prime Minister will initiate the inquiry. And if a high compensation, if a person is high net worth, otherwise earning maybe let's say 2 lakhs or 5 lakhs a month, then under those circumstances, compensation which will be awarded for not giving him ventilator will be 50 crores or so. So my point is, law is forcing me to discriminate between patients on the basis of their socio-economic status. Because when you are awarding compensation, you are awarding according to the earning capacity of the patient, not according to what negligence I have done. This is a flaw in the law and it conflicts with my medical ethics. Then If a doctor has to accede to a relative's request, this happens daily in all ICUs in the country. The patient's relatives initially, doctor, do everything you can. Once we have put the patient on ventilator, through second day, third day, fourth day, they are no longer able to afford the cost. The doctor understands the patient's relatives cannot afford the cost. They beg you to switch off the ventilator or somehow let the patient die, but law does not permit. If I follow the law to switch off the ventilator, it will take me at least 2 months to get permissions to switch off the ventilator. This is a conflict between medical ethics and law. I am with the patient's relative. I don't want the patient's relative to spend money. But the law does not permit me to switch off the ventilator based on a relative's request. Then for a patient who has cardiac arrest, and I am asked, despite knowing very well the patient will not survive, or despite knowing very well we have already revived the patient 10 times earlier in the past, and there is no chance of this patient surviving, but law does not permit me to decide that we will not resuscitate. Similarly, how many doctors today would stop at an accident site to assist a patient? Why? I will tell you. We had a professor in PGI. There was an accident while she was coming from her home to PGI. There was an accident on the roadside. She stopped the rickshaw puller. She put in her car, and the accident was not with her. She was a passerby. She brought the patient to PGI emergency. She was made an accused, and she had to fight a case for 10, 12 years to get off from the allegations. Similarly, doctor using surrogate mother to deliver child of Karan Johar, law permitted it that time. But it was, if you ask me today, it is against my ethics. For a doctor to desire that the patient he is resuscitating dies, but does not go into a vegetative state. Because today, as the law stands, if a patient goes into a vegetative state, the compensation as it is calculated will be much, much more than if the patient dies there and then. This is against what I was taught when I was in medical colleges. When a patient goes into cardiac arrest, I am told to resuscitate irrespective of what the outcome is going to be. The thought never came into our mind that this patient may have brain damage. We used to keep resuscitating for up to half an hour at a time, and sometimes these patients did come back. I am one of those who was resuscitated and I came back, and it is nearly 17 years since I was resuscitated. But law forces doctors into a corner. Then for a doctor to close the abdomen during appendectomy, despite finding an inflamed Meckel's diverticulum, knowing that another surgery will have to be done in near future. This is Samira Kohli versus Dr. Prabhavan Chanda judgment. If I have not taken consent for a particular procedure and on be doing a surgery, I find another surgery has to be done, I have to stop the surgery, allow the patient to come out of anesthesia, take consent for the second surgery on a different date, and go ahead and do. Even if you think it is in the patient's interest, you cannot do what you think is ethically correct. Routinely, we used to be taught that in case we were operating for a gallbladder or we used to be operating on the intestines, appendix used to be removed routinely. Today, law prohibits it. This is again a situation where there is conflict of ethics and law. And of course, law will win. So routine test of this case of Sanjay Mutha versus Dr. Jayashri, listen to what the High Court has to say in this. Had Shrimati Rupa Mutha died during the procedure, it would not have given so much trauma to husband and daughter, hence imprisonment for doctors. The doctors had done a test for patency of fallopian tube and gas embolization happened. Cardiac arrest occurred, they resuscitated, patient went into vegetative state. The court says it would have been better if the patient had died. This, I find, was totally against what I have been taught and what I consider to be my medical ethics. for a doctor to know he can save life of an individual by doing a procedure, but he does not do it. Why? Because one, it is a high risk procedure and it is being done in an establishment which does not have an ICU. And he is afraid what the court's view will be later in case of a negative outcome. But when we do this, when I know I am competent to operate, when I know I can save the person's life, when I know very well if I refer this patient, the patient will die on the way. But I still do not do the procedure because I am afraid that tomorrow the court will ask me, you did not have an ICU, why did you operate this high-risk patient? Similarly, a surgeon who does not operate without an anesthetist in a patient with fetal distress, knowing the fetus will be dead by the time the patient is shifted to higher center. Again, these are situations which are arising, which are in conflict with our medical ethics, where the law is intervening. Patient dying, driver who is also being paid is a donor who is available, but doctors cannot do a renal transplant. Do you know how many people die without renal transplant every year? More than 1,25,000 people die every year for want of renal transplant. There are people who are willing to donate the kidney, but paid kidney donation is illegal. So even though you know that this driver has been working with the fellow for the past 20 years, there is a good relationship between them, but the owner has offered the driver some money so that he can also look after his family. And this makes it against law, so we cannot do it. But supposing if people were allowed to sell their kidney, one, there would be no illegal trade, no exploitation, no middlemen. Checks and balances could be brought into place to safeguard interests of donor. Countless lives on both sides would be saved, potential recipient and potential donors, and no doctors would be arrested so that newspapers can sell based on sensational headlines. There are countries where sale is regulated by the national body which looks after the transplantation process. And it is time to start thinking out of the box and being within a very rigid straitjacket of the law is difficult, because I personally feel if a person is dying and I have the competence to help the person and I'm not helping the person because of the law of the land, there is something wrong somewhere. Medical termination of pregnancy is illegal in some countries. But with 23-week-old fetus surviving with proper care, is it ethical to permit MTPs up to 24 weeks, as has been done in the new MTP Act? Again, a conflict between law and my ethics. Forcing anesthetists to take up cases not fit for surgery, even in government institutions, is that ethical? The God complex surgeons throwing tantrums in operation theaters against anesthetists, residents, and nurses, is that ethical? I have another question to ask. Being awake for 24 hours is equal to having a blood alcohol content of 0.10%. And if doctors working under the influence of alcohol is unethical, then so is forcing them to work in sleep-deprived state. Then how are we so proud that we used to be working for 72 hours non-stop in our residency days, and doctors today are weak and they get tired after working only for 12 hours? This is unethical expectation on behalf of us seniors from our junior doctors. The demands of globalization, corporatization in healthcare leave no scope for professional ethics. Healthcare is significantly affected by globalization. Despite its public good and non-commercial nature, new business opportunities have been identified within healthcare environment, and business ventures and collaborations have stepped in. Globalization is mainly due to the decline in public sector expenditure and the liberalization of related sectors such as insurance and telecommunications, increased mobility of consumers and health service providers, and technological advances. The differences in cost, availability, and quality of healthcare, the emergence of investment opportunities in healthcare sector with liberalization of investment regulations, and general increase in demand for health services arising out of income levels and aging population. Healthcare now has shifted. It has been identified as a sector where money can be made. And this has been identified by corporate giants. It has been identified by businessmen. And healthcare today has shifted from the hands of medical professional ownership to businessmen. Hence, no relevance of ethics of professionals in business enterprises. Medical education for sale. Till 2009, only non-profit trusts and societies could run medical colleges. In 2010, firms under Companies Act were permitted to run medical colleges. Then August 2016, companies run medical colleges for profit. This was allowed in January 2017. Even existing non-profit trusts and societies were allowed to convert into profit-making ventures. And new education policy has now done away with all fee regulation for all courses. So in summary, healthcare is no longer a profession in India. It may be a provocative statement. I'm going to stand by it and I'm going to argue it. This has been done under Consumer Protection Act as well as National Medical Commission Act. Globalization and corporatization has changed the character of healthcare. Cost of newer medical technology is high, and investment and return are the new buzzwords instead of care and compassion. Over-regulation has eliminated small and medium healthcare establishments from healthcare scenario. These were the mom and pop stores or mom and pop nursing homes which were dotting the country, let's say around 2 to 3 decades ago. And these are all now closing in favor of larger corporate setups. Interference of law in matters which were essentially medical leaves little scope for professional ethics. I've given you umpteen examples. I mean, it's up to you to judge whether those examples are correct or not. Doctors are mere tools for the healthcare industry. We no longer own healthcare industry, and professional ethics are used to keep a check on the doctors, to make them toe the government line, to make them toe the businessman's line. Hence, in my view, ethics today has no role in healthcare in India. Thank you so very much.
Thank you, Dr. Neeraj, for so strong wordings. As the time we have taken a large time than stipulated, I would request Dr. Satish Tiwari to come with the concluding remarks. Dr. Neeraj, Dr. Tiwari, are you ready?
Yes,
I am
yes,
ready, no problem.
Oh, you are asking Dr. Satish Tiwari, sir.
कौन से तिवारी जी को पूछ रहे हैं? I am also.
Sir, आपसे ही पूछ रहा हूँ.
Yes, I am ready. कोई problem नहीं है.
So, in view of Dr. Neeraj Nagpal's speech, I would like you to say something, but in short, so that we get a message, the audience get a message. What should we do?
Yes, I think what various speakers have said, the most important reason for if we say there is increasing unethical practices in medical sciences, it's basically what I also agree with what Dr. Nagpal sir was saying, is the globalization and commercialization of medical practice. In other words, whenever I say the things, I say we are in an era where we have to differentiate whether we want to worship Saraswati or we want to worship Goddess Lakshmi. So the ethics and money cannot go hand in hand. That is the basic summary you can say of all the speakers whom we have listened today. So we have to decide somewhere whether we want to worship Goddess Lakshmi or we want to worship the Goddess Saraswati. And as many examples given by all the speakers, we have to keep in mind that if we want to have ethics, somewhere we will have to forget the money. If we want to have money, somewhere we will have to forget the ethics. So though there is a line somewhere in between, we have to keep in mind that we somehow we will have to cross the line in our practice. So if you want ethical doctors, we'll have to go back to our ancestral days when money was less important and ethics were more important. The self-regulation, the morality, the self-introspection, what we have discussed was more important about 1 or we can say 2 decades back. But if we want to practice in the present era, where money is more important, not only for the doctors, but even for the government, but for the corporate hospital, but for the private medical college, money is important, you will have to forget the. So these two cannot go hand in hand. Either we have to forget money or we have to forget the ethics. Because we have seen that the regulatory bodies, it is not difficult for them, for the regulatory bodies, for the government, for the judiciary, they have the whole, we can say they have all the authorities, all the machinery which can look after, which can find out who are the ethical doctors in the society, who are the ethical doctors in the community. But we see that ethical doctors do not have protection neither from the community, nor from the judiciary, nor from the government. So many times, as we have discussed in the last 1 hour, if you try to do ethical practice, there are so many problems and there are so many persons who are going to object to your mode of practice. Many times, as said by Dr.Neeraj Nagpal sir, if you are doing ethical practice, nobody will come to you if something happens which is not according to the law or according to the acceptance or the according to the what the community wants. So that's why many times we say that if we want ethical doctor to survive, the community, the government, the judiciary, they will have to protect the ethical practice. Otherwise, we are in an era where almost every patient, now he has lot of money, whether of his own or he gets from the insurance company or he gets from the government schemes like the Mahatma Phule scheme or the Ayushman Bharat, where government is paying for the patient. So expectations of patient, they are very high. The patient or the relatives feel that if we are paying the money as per the requirement of the hospital, why the outcome should be something in the negative. If the doctor or hospital is getting money, the outcome should be 100% positive. All the patients should survive and they should have the intact survival. So no deficiency in the outcome. As rightly discussed, there are many cases where even if slight deficiency remains, the patient is taken to the court of law. Why my patient survived and now why is in a vegetable state? So all these things still, as we discussed, I don't want to repeat everything, but if we give importance to the money, the ethics is not going to do. Private medical college, everybody knows that there is lot of things manipulated for the want of money. Everybody knows, government knows, the NMC knows, the judiciary knows. But all these, as Dr. Neeraj Nagpal sir has very rightly said, initially the hospital, the private hospitals were run by charitable trust or the charitable societies. Now they are run by the money minting corporate or the media whose only aim is to earn the money. So with all this, we cannot have the ethical doctors, especially if the community is also not in favor of the ethical doctors. They also want the 5-star facilities because they have the money from the medical insurance scheme or from the government scheme. So they want 5-star facilities. So ethical practice may not be possible for a 5-star city. So I think what everybody has said, though there is a need for self-regulation, self-introspection, and we say that ethical practice is the best practice, I agree that in present situation also, ethical practice is best practice. But if everybody follows the ethics, ताली एक हाथ से नहीं बजती, we cannot clap with one hand. So only by having the self-introspection by the doctors, only by the practice done by the ethical doctors, it may not be possible. So every stakeholder, unless and until they become ethical, whether it is government, whether it is judiciary, whether it is the community, they should also be ethical. They should also protect the ethical doctors, the ethical hospitals. Then only we can have the ethical practice or ethical. Otherwise, if money is going to direct the things, then we must, or at some stage, we will have to forget the ethics. So I think that is what is the situation in the present era.
Thank you, Dr. Tiwari, for summing up. I would like to say that ethical practice is possible in an ethical society only. When society as a whole is unethical and you expect only one part of the treating doctors to be ethical, that is itself unethical thought. That's my take. And Dr. Nagpal has very rightly pointed out between the conflict in ethics and law. And a very valid problem. So I hope that the doctors and the society should get a message, and IMLEA should also write to the NMC and the Ministry of Health about these situations so that the health situation in the country improves. And if anyone else who would like to say anything, so that we can conclude now. Yes, Dr. Mukul?
Sir, I heard with interest Dr. Neeraj Nagpal sir's talk, and I have to just make a few disagreements or observations. He said that doctors are not respected anyway, but it is not right. Doctors are still very much the most respected professionals among all the professions, and we should try to retain our image despite everything which is going on, and despite all the beating and all such news. Still, we are respected. Second thing, ethics. So he was saying that it is imposed by NMC on us, but ethics, medical ethics are universal, apply and applicable to every society, even Europe, in America, in Japan, everywhere. Ethics are everywhere. They're not only coming through NMC here. Third point, I very much agree with him that so many patients are dying of for the lack of kidney transplant because of some foolish ethical rules laid down by the government. Here I 100% agree with sir that there should be some solution out of it. So his point was that theoretical application of ethics is wrong, and I agree there. I very much agree there that ethics must be there, but theoretical and foolish practice of it is also bad. Thank you very much.
Thank you, all the panelists and the faculty, the speakers, for such an enlightening views on a very controversial topic. And I hope the audience must have listened to all the things very carefully and enjoyed the debate, and something solid should come out of such debates. Thank you, sir.
Thank you very much.
Thank you, everybody.
Thanks everybody for a very nice, lively discussion. Dr.
I would
Neeraj
like
Nagpal,
to
sir.
say one. I would
Yes.
like to.
Yes. Dr. Anurag.
Dr. Sirohi, sir. Yeah, if you permit me, I would like to say something because
Yes, yes.
both of the advocacies of who have
You are not clear.
advocated this debate against the ethics, they have. Am I clear now?
No,
Yes,
we can't hear you properly.
Okay, then I
speak now.
will.
Better.
Hello, am I clear now?
Dr. Anurag, you are visible, and if you speak, you will be audible.
Am I audible now?
Yes, yes.
Am I audible?
Yes,
Yes, you are audible.
Again, you are not
There is-
audible.
No?
Yes, now you are audible.
Hello?
Don't. You are audible now.
Both of the respected sirs, Dr. Neeraj Nagpal sir, present, and Dr. Jaggi sir, who is also very well versed with medical legal at the moment. There is corporatization of the medical profession, and corporates have taken over only the medical profession. I don't think, sir, this is true, because there are business ethics and medical ethics. Business ethics are different and medical ethics are different. If the business ethics, they are taking over the medical ethics, and the government or the NMC also should take action, and they have started taking action. And we can see now in the code of ethics, which has been proposed by NMC, corporate hospitals have also been included within the purview of this misleading advertisement. Number one. And there is a SC judgment recently that it is also unlawful for the pharma companies to give freebies to doctors. It is not in business. They said that this is our business tactics, business requirement. The STS said that the law should not be self-repeating. If it is unlawful for the doctors to receive freebies, it is also unlawful for the pharma companies to give freebies to doctors. Number two. Number three, sir, there have been recent, only after two days back, there are multiple raids by IT department in Delhi hospitals, and they have unearthed a sum of around 150 crores from the corporate hospital, which was being maintained in the parallel books while the commissions were being paid to the towns, where the commissions were paid to the referring doctors, like this. So the government is also, I think, aware of these things. And my contention is this, that what I have said keeping in mind the real doctor who is coming in contact with the patient. He should be ethical. And if he is ethical, then I don't think that the government hospitals and the people sitting over there, they can pressurize the doctors. I know doctors who have left these corporate hospitals. They are not able to perform what was mandated by these hospitals. So it is my contention that ethical principles, it is very rightly said by Dr. Neeraj Nagpal sir, it is nothing but self-regulation. Yes, he is very right in saying that. And we should know this. This has been, potentiated by the law. That the law has to see whether everybody in society, whether he is a doctor, he is an engineer, chartered accountant, many other engineers, anyone who is actually abiding with these ethics which are there in and law has to take it. I know, and these ethical dilemmas and these this conflict between the ethics and the law. I fully agree with Dr. Neeraj Nagpal that there is no doubt about it. There is a lot of confusion about it. These dilemmas are there, and we should take out a solution of it. This is what I want.
Thank you, Dr. Anurag. Now it's time to say good night. So thank you.
Okay. Good night.
And
Thank you, everybody.
hopefully looking for some other talk from you. Thank you, sir.
Thank you.
Okay.
Thanks, everyone.
Thank you. Bye.
Good night.
everyone.
Bye-bye, good
Shubhratri.
night.
Shubhratri.
Shubhratri.